Welcome everyone. Good morning everyone. Dr. Agarwal Kan Hospital massive expansion program start ஆகுது. இப்போ நம்ம கிட்ட இங்க 155 eye hospitals இருக்கு. That is including India and Africa. We are in about 10 countries. Our expansion is going to be now to touch 300 eye hospitals in the next 2 to 3 years. That is the main thing which I wanted to talk about. So, we are now 155 eye hospitals in 10 countries and we will be touching 300 hospitals in a massive expansion program. Now, for this, நம்ம கிட்ட fundraise last year TPG, Texas Pacific Group, which is the top private equity player, and Temasek, which is the sovereign fund of government of Singapore, gave us 1050 crores. 1050 crores கொடுத்துன இப்போதான். Again now they have given us 664 crores. So actually within a span of 1 year, we have got an investment of about more than 1700 crores plus, nearly, from TPG and Temasek, from two people. They are very big private equity investors. Plus we add to this, we have internal accruals. So we will be pumping in more than 1200 crores now to touch 300 hospitals. நம்ம மெயின் என்ன இருக்கீங்க தமிழ்நாடுல இப்போ நம்ம கிட்ட we have about 40 plus centers, 40 hospitals in Tamil Nadu alone. We will be opening 10 more in new locations. Also, Maharashtra, we have opened a new corporate office. When any of you go to Bombay, please come and visit it in BKC area. புது corporate office இருக்காங்க. இப்போ நம்ம கிட்ட மகாராஷ்டிரால 20 eye hospitals இருக்கு. We got 20 hospitals. 10 are in Bombay alone. And இப்போ நம்ம growth இப்படி இருக்கு ரெண்டு methods இருக்கு. One is we can start from fresh greenfield project start ஆகுது, but we are now going ahead with these Bombay, Maharashtra brownfield. That means we are acquiring hospitals. So in one shot we are buying out many hospitals, so the growth is much faster. One more thing I want to tell you all is 3 geographical areas, Delhi, NCR and UP நம்ம கிட்ட இல்லங்க. We are opening into these 3 big areas, and you can see UP huge, Delhi is huge, NCR is huge. Africa le நம்ம கிட்ட எப்போ இருக்கு 16 hospitals, 16. We are opening in new countries like Nigeria and Democratic Republic of Congo, DRC. We will be opening 30-40 hospitals in the next 2-3 years in Africa also. So இதே 300 hospitals நம்ம என்ன சொல்றது, நம்ம main aim என்ன இருக்கு, the 300 hospitals to show an expansion into India and in Africa. இப்போ நமக்கு 10 countries இருக்கு, we'll be touching 12 countries because I said we'll be adding Nigeria and Democratic Republic of Congo. One more thing which I want to tell you all is, இப்போ நம்ம இங்க தமிழ்நாடுல we are opening eye clinics, small centers, tier 3 cities, even in small locations like Chengalpet நம்ம ஓபன் ஆனது. இப்போ நம்ம 12 eye clinics ஓபன் ஆனது. ஆம்பூர்ல இருக்கு, we are opening in Karur, கௌரிவாக்கம்ல இருக்கு, செங்கல்பேட்ல இருக்கு, எல்லா பிளேசஸ்ல நம்ம eye clinics. இதுல என்ன இருக்கு, we are going to give free examination for anybody, and you can mention this in eye clinics, all things will be totally free. We were allowing people to walk into eye clinics, examination, everything free. If they need surgery, யாருக்கு இந்த சர்ஜரி வேணும், கிட்ட இங்க ஹாஸ்பிடல் இருக்கு அகர்வால், அங்க போயிட்டு ஆபரேஷன் பண்ணலாம். But all the examination, everything is totally free in eye clinics. இப்போ நம்ம கிட்ட 12 eye clinic இருக்கு. We are going to open 40-50 eye clinics by this year end. So as in all, நம்ம ஐடியா என்ன இருக்கு, to show, இப்போ இந்தியால நீங்க பார்க்கலாம், there is about 1.2 crore blind. இதுல 55% போற பத்தி இருக்கு. இப்போ நம்ம பார்க்கல இதுல இவ்வளோ பேஷண்ட்ஸ் பிளைண்ட் இருக்கு. ஸோ ஆப்வியஸ்லி இஃப் யூ ஹேவ் மோர் சென்டர்ஸ் த இராடிகேஷன் ஆஃப் பிளைண்ட்னஸ் இஸ் ஆல்வேஸ் ஃபாஸ்டர். One more thing I say, with all this, we are also doing latest treatment. இப்போ நம்ம சொல்றது latest treatment, pinhole surgery. இப்போ யார்கிட்ட ஃப்ரண்ட் விண்டோ கார்னியா இருக்கு, டேமேஜ் இருக்கு, நம்ம டிரான்ஸ்பிளான்ட் பண்றோம். யார் சத்த போடுற கண் எடுத்துட்டு இங்க போடணும், அது நம்ம சொல்றது ஐ டிரான்ஸ்பிளான்டேஷன். இப்போ நம்ம புது ட்ரீட்மெண்ட் இருக்கு, பின்ஹோல் சர்ஜரி. நம்ம கண்ணு ஒரு பின்ஹோல் மாதிரி கிரியேட் ஃபார்ம் ஆகுது, அப்புறம் கண் டிரான்ஸ்பிளான்ட் வானா அதர் கேசஸ்ல. So in many cases which may need eye transplantation, today because of pinhole surgery will not need eye transplantation. And please understand, this is a big benefit because it's not only in India, even in Africa we are doing pinhole surgery and these patients can benefit from that. So again, to tell you in a summary, basically what I want to tell, Allah perkitta enna solnom, number one, Agarwal Kan Hospital is going massive expansion to touch 300 eye hospitals in the next 2 years time. Second thing is, TPG and Temasek gave us 1050 crores just now, 1 year back, and again now they are giving us another 664 crores they've already given us. With all this, we are going to invest another 1200 crores to create these 300 hospitals. We are also opening up Agarwal eye clinics. Na solna Ambur Karur in many places நம்ம Agarwal eye clinic open ஆறுது. Africa we are expanding further and opening into new countries like Nigeria and Democratic Republic of Congo. இப்போ நமக்கு இந்த ஜாம்பியால இருக்கு, நம்ம முன்ன ஒரு ஹாஸ்பிடல் இப்போ 4 இருக்கு, மொரிஷியஸ்ல இப்போ 3 இருக்கு, மொசாம்பிக்ல இப்போ 2 இருக்கு. So we are going to deep dive into these countries so that we can expand further. Okay?
Thank you all for being here. Firstly, would like to take a moment to thank all of you for your support and everybody from Chennai, because we have grown from 1 hospital to 150 hospitals and now are the largest player in many of these states. Mumbai we have 10 hospitals, Maharashtra we have 20 hospitals now. So we have a total network presence across the rest of the country except Delhi, NCR and UP. It's a great thing for a Chennai-based firm to get investments of such size from across big investors in USA and from Singapore. Whatever investments will come, we will be using that to expand Agarwal Eye Hospital network across the rest of the country. We're looking at expanding more into Mumbai, into Delhi, into UP, into Punjab, some of these regions. Along with this, we're also looking at setting up 100 clinics like what he was talking about. Look at, right now we have, as an Agarwal Eye Hospital group, we have over 400 to 500 doctors and over 4,000, 5,000 employees. With this expansion, we are looking at, catering to at least 10,000 to 12,000 employees, providing employment opportunities, 10,000 to 12,000 people, and over 1,000 doctors. Along with this, a lot of other opportunities we will be able to provide to a lot of people. We are looking at setting up big hospitals in most of the major cities, along with smaller hospitals in tier 2, tier 3 markets. So it's not like we're only looking at Chennai or Bangalore or Hyderabad. Tamil Nadu Pathina, we have in Tirunelveli, we have in Nagarkoil, we have in Madurai, we have in Trichy, all these kind of places. Similar strategy we are following in other states as well. In Karnataka, it's not just Bangalore. We have in Hubli, in Dharwad, in all these smaller markets. That is the way we are looking at expanding, and hopefully we should get to about 300 hospitals in the next 2 to 3 years. From there, the long-term plan is to get to 500 hospitals across the rest of the country. Not just in India, but we are providing great work because of our team in Africa as well. There also we are treating patients who have no access to healthcare. So I think it is a very, very proud moment for people, from Tamil Nadu. Overall, if you see, the India market is getting a lot of funding from across the world, especially in the healthcare sector. So it is not just Agarwal. If you see, our close neighbor Kaveri Hospital also recently got a fundraise done. Apollo Hospital is obviously doing very well. Another player from here, Maxivision, also got funding done. So a lot of support is coming in terms of healthcare investments into Tamil Nadu-based companies and India per se as a region, which just shows that the story for the next 5 to 10 years lies with India. Indian economy is growing really well. Along with that, a lot of investments are coming in from a lot of global investors who see India to be the next big opportunity. So, once again, want to thank you all for coming here and listening to our expansion.
பார்க்கலாம். That means our patient comes with at least 2 attendants. So every single day, at least 50,000 people are walking into some Agarwal hospital or not. this number will actually double. So effectively in the next 2 years time, we will be touching 1 lakh people walking into Agarwal hospital, some center or the other, every single day, which is going to be huge numbers. That is what. So with all this number expansion பண்றது high tech quality care கொடுக்கிறது. So we are trying to make the whole system in eye care into an organized sector. So the advantage when we are buying out other hospitals is we are getting ready made, the doctor, the team, the equipment, everything is ready made available there. That is why Bombay la நம்ம open ஆனது better to acquire. பஞ்சாப்ல இப்போ நமக்கிட்ட 7 hospitals இருக்கு, ஜம்முல இருக்கு, and that is the main aim of the group. I want to thank everyone for coming here because we thought this is a very, very big expansion project and we wanted to share with all of you. Approximately, let's say 1.8, 1.2 to 1.5 crore blind. இதுல 55% போற பத்தி இருக்கு. நம்ம இந்தியால என்ன ப்ராப்ளம் என்ன இருக்கு? Two problems. One, sunlight. Second, food. Because of the food habits being bad and sunlight being a lot, நம்ம பொற normally it happens at about 50 years. Suppose நம்ம அமெரிக்கால பார்க்கறேன், பொற will start at about 70 years. In India we get earlier cataract. So the statistics are 55% of, let's say, even 2 crores, approximately 1 crore blind because of cataract. Only because of cataract now. பொற பத்தி சொல்றேன். இப்போ male female both are equal. Okay, right eye left eye, if it happens in one eye it will happen in the other eye. It is not that it happens in one eye unless somebody punches you. But one advantage என்ன இருக்கு இதுல, யார்கிட்ட bomb blast ஆனது, let's say yes அடிபட்டுச்சு, இப்போ நம்ம லென்ஸ் போட முடியல, இப்போ நம்மள கேமராஸ் இங்க இருக்கு, சப்போஸ் நம்ம லென்ஸ் எடுத்துட்டே பார்க்க முடியல, நம்ம இத க்ளூ லென்ஸ் போட்டுது, புது டெக்னாலஜி, நம்ம கம் போட்டு உள்ள லென்ஸ் ஃபிக்ஸ் பண்றது. So with that, even those people with bomb blast will be able to see. One is because of the sunlight. There's a lot of rays coming inside. That's why I tell people when you go out, wear Ray-Ban sunglasses, these ultraviolet protected sunglasses to protect the rays from going in. But the second biggest story is food. See, if I've got diabetes uncontrolled, I will get early cataract. There's no doubt about it. So what I tell people is take care of your food. Small children from beginning, if you tell them நல்ல கீரை சாப்பிடுங்க, வெள்ளரிக்காய் சாப்பிடுங்க, when they grow up they remain healthy. அமெரிக்கால என்ன அட்வான்டேஜ் என்ன இருக்கு, they are very fit from beginning, their food habits are very strong from beginning. That culture we have to start in India. So CM scheme இருக்கு. இப்போ யார்கிட்ட ரெட்டினா டேமேஜ் இருக்கு, I'm small example, நீங்க டயபெட்டிஸ் பத்தி சொல்றேன், suppose டயபெட்டிஸ் பத்தி கண்ணுல ரத்தம் இருக்கு, okay, all they need to do is come to the hospital, no charges at all through CM scheme they can get treated totally. So CM scheme which our honorable chief minister is doing is excellent work which our chief minister is doing. இதெல்ல advantage இருக்கு இதுல. You are saying something? Not only go to preventive measures, what we do is, one is we go to corporates. So let's say இப்போ நீங்க எல்லாம் ஜர்னலிஸ்ட் இருக்கு, continuously நீங்க பேர் immediately now deadline, okay, deadline, you'll be straining continuously. This is reality, correct? No, நான் என்ன சொல்றேன், நம்ம போயிட்டு ஆபீஸ்ல போயிட்டு சொல்றது cool down, nothing will happen. 45 minutes you work, 5 minutes take a break, do palming, again back to work, you'll be all right. Same thing நம்ம schools போறது, schools ல நீங்க பார்க்கலாம், கோந்தல்ல இப்போ இதேதான் 24/7 டிக் படிக்கல, சும்மா டிவி சீரியல் பார்க்கிறது இல்ல, correct? No, so you cannot stop it. Please understand, my grandson also watches, I cannot stop him, okay? But all we can do is educate them. Dryness வரணும் இல்ல கண்ணுல, so take a break after 45 minutes, take rest, again start again. That's what we can do. So we are doing the screening to prevent. Prevention is better than cure. Most important is all of you, because when you give education to outsiders, eat well, it helps. Otherwise they will go berserk in eating. இப்போ மிட்டாய் சாப்பிடுறது, இது சாப்பிடுறது, அது சாப்பிடுறது, கண்ட்ரோல் இல்ல சுகர்ல. I'm only telling them after 45 minutes take a break. This is not only for children, even for you. For example, நீங்க journalist இருக்கு, continuously நீங்க you're on the screen. So what is happening, suppose நான் continuously the screen பார்க்கிறது, please understand my eye has to blink. Then only fluid will move from one end to the other, dryness இருக்க மாட்டேன். This is normal. When you are continuously straining like this, the eye does not blink. அது கம்மியாகுது. When the eye blinking coming out there, the fluid will not move. You will get dryness. When you get dryness, you get headache. You get strain. That's when the problem starts. Second or third floor, you go and see all of you. I have a machine which tests the dryness. I am telling you, if you all go and see, you will get shocked. You will all have dryness. You won't even realize நம்ம கிட்ட இருக்க dryness. So the புது machine இருக்கு which assesses how much dryness is there in your eye. Suppose இருக்கு நம்ம drops கொடுக்கலாம். ஜாஸ்தி இருக்கு அதை ட்ரீட்மெண்ட் பண்ணலாம். Outpatient treatment. There is no inpatient treatment, sir. Outpatient treatment பண்ணிட்டு நம்ம செக் பண்ணலாம் and correct the dryness.